There are different kinds of eye discharge, and today I'm going to be telling you about the non-infectious kind of eye discharge, which we commonly see around the canthi of our eyes, especially when we wake up in the morning or rarely during the day, known as rhume, sleep, or eye gooping. Basically, a rhume is a combination of mucus from the conjunctiva, oil from the meibomian gland, dead skin cells, sand, dust, and other kinds of debris that accumulate around the canthi of our eyes. The part of your eye I'm calling the canthi is the part of your eye that is close to your nose, and this other part, this is your lateral canthi, and this is the medial canthi. Now, this is how rhume is usually formed. Along the edges of your eyelid, both the lower and the upper lid, is a tarsal plate, and this tarsal plate comprises of 25 to 30 tarsal gland, which secretes oily gland on the surface of the eyes, which reduces evaporation of tears in order to keep your eyes moist or lubricated. So during the day, when you have gone out to hustle for money and the rest of them, you enter the bike or public vehicle, especially without protecting your eyes, or your occupation exposes you to a dusty environment, your eyes, especially the conjunctiva and the cornea, tends to absorb this dust, debris, sand, and the rest of them, and this mixes up with the oil that was secreted on the surface of your eye. This is what causes a rhume. During the day, when you are still blinking, when you are awake and blinking, rhume is usually flushed out through the nasolacrimal duct or tear duct, and at this point you will notice that the rhume or the discharge is wet and sticky. So when you have gone to bed, due to absence of blinking reflex or blinking action, rhume accumulates around the canthi, especially the medial canthi, and at this point you will notice that the rhume or the discharge or sleep is dry and crusting. Now the question is, do you need the attention of a doctor? The answer is no. This is because a rhume is a function of the tear film as a component of a good eye health. It means that this is the way your eyes flush out harmful waste products or debris from your eyes, and as such you do not need the attention of a doctor. However, as an individual, it can also be the cause of frequent occurrence of a rhume in your eye when you touch your eyes without washing their hands first. You can pass on a debris, bacterial infection, and the rest of them from your hand to your eyes, and this can also cause frequent reoccurrence or occurrence of a rhume in the eye. And when you go to a dusty environment without protecting your eyes, I've made a video on how you can protect your eyes, especially now that we are entering dry season. You can check back on this video. Please go to my YouTube channel handle, that Seeing is Living, to grab the knowledge. Here are the things you should do when you see a rhume in your eye. And when you see a rhume in your eye, you can do a warm water compress. A warm water compress simply means you getting a clean towel or a handkerchief that you not use on any other part of your body, soak in a warm water, then use it to damp your eyes. It helps to clean or flush out this rhume, and also to keep your eyes healthy and clean. Lastly, the normal color of a rhume is white or milkish. If for any reason you notice that your rhume or discharge is now yellowish or greenish, it means that you need a medical attention, because it could be an indication of a bacterial infection or any other kind of infection, and of course the need to meet a doctor. I believe this video is top notch, and of course you need to subscribe in order to get updates on how to keep your eyes healthy. Thank you. Till we meet again.